Thank you, Mr Speaker. My question is to the Minister for Health and Aged Care. Will the Minister please outline to the House how the Morrison government has continued to protect the health of Australians throughout the COVID-19 pandemic?
The Minister for Health and Aged Care.
Thank you very much, Mr Speaker, and I want to thank the member for Higgins for her question and her service to the nation through her career both in the parliament but before the parliament. Importantly, we know that the pandemic has accelerated this year. Sometimes it's lost that there were approximately 80 million cases last year and over 120 million cases this year alone so far as part of a global pandemic. There were 1.8 million lives lost last year. There are nearly 2.5 million lives lost already this year. So that pandemic that so many had predicted would finish within 1 year has accelerated and expanded globally during the course of this second year. Against that background, what we have done is maintain and extend and expand our long-term national health plan. As part of that, of course, COVID protection has been fundamental, and I went through some of those elements earlier on. But critically, we have put in place arguably the most significant reform of Medicare since its formation with the creation of telehealth. Over 68 million consultations have now been carried out. That's had a profound effect in the delivery of health services around Australia, not just in response to COVID, but on an enduring basis. It has helped transform the way that health services will be provided to older Australians, to parents with young children, in particular to people in rural, remote and Indigenous Australia. But at the same time, one of the things we've also had to do is ensure powerful mental health supports. We've not seen an increase in the suicide rate despite predictions, and that's an immense national achievement. We've not seen a decrease in the suicide rate despite all efforts. So there's more work to be done on that front. But what we have done is put in place mental health support in the pandemic, which has inevitably saved lives and protected lives. That has been expanded just on the weekend with the extension of the Head to Help program in Victoria, the expansion of it to New South Wales with 10 new clinics, including 7 across Sydney and 3 across rural and regional New South Wales. But at the same time, we've expanded Medicare, going from $19 billion when we came in to $30, $31, $32 and $33 billion over the forward estimates. We've seen in the last year 30 million diagnostic services. We've seen well over 100 million pathology services that have all saved lives and protected lives, and expansion of the PBS with a new drug commencing on the 1st of August, Evrysdi for spinal muscular atrophy, which will give 100 children a chance at a better life, a longer life and a safer life. All of these things are saving lives.
And I call the member for Scallon.